Cancer is a very scary time in everyone's life, and I think it's not only the patient who is concerned about themselves, but how it affects their family. So I try to really pace it for the patient so that we can go through it in a stepwise process, because I find that if you put in a stepwise process, patients are able to digest that information and feel like it's not so scary, because it's not just this overwhelming word. It seems like it's something that you can surmount and achieve a good outcome at the end. My name is Premal, and when patients look me up on the web or just look at a name, they're very afraid that it might just be a male. And I have great male colleagues, but I think, a lot of women do relate to women, and so they're very reassured. So I used to get that all the time, like, thank goodness you're a female. So I do think that is reassuring, but I think the most important is that, we are here to take care of you as a team. All my patients really know that I'll spend as much time as they need for me to give them their optimal care. I always wanted to be a physician. My father's a physician, but I think what really cemented my sort of love for cancer was my grandmother was diagnosed with breast cancer when I was 16, and I remember her going through her care, and I was thinking, I'd love to be in a field where it's a little bit more streamlined, but I think as a patient, it makes it very difficult to know who to call if I have this side effect. Do I call my radiation oncologist? Do I call my medical oncologist, my surgeon? And GYN oncology really provides us the opportunity to be your one-stop shop. We sort of tell the patient, even if you have no idea who to call us. Once you're our cancer patient, you're always our patient. I knew I wanted to have my career in a place where I can actually, not only practice great medicine for patients, but also push the envelope for the future and develop clinical trials and treat patients with the most cutting edge technology, as well as therapeutics. Because GYN oncology, we're very unique. We're not only your surgeons, but we're also your chemotherapist or your biological therapist now in today's age. So we get to really have very long conversations with our patients and a long relationship, which makes us unique in terms of surgical oncology. I would love to be out of a job because we've cured your cancer. And so I think the only way we'll do that is with our clinical trials. So I've sort of transitioned myself from looking at stress biology and cancer progression to more like novel therapeutics and trying to really do early clinical trials all the way to advanced, phase 3, hopefully the next standard of care clinical trials. Sometimes surgery is not the first answer. Sometimes it's actually trying to shrink the cancer with getting chemotherapy, but most importantly is making that diagnosis, because we have lots of patients who come to us with a suspected diagnosis from the outside, and we make sure we confirm that diagnosis, because really we need to make sure we're treating the cancer and where it originates from, because sometimes when it's ovarian cancer, it's thought to be ovarian because it just has an ovarian mass and has all these different implants. But there are times where I have definitely diagnosed somebody with a GI malignancy that has spread to the ovary, and I need to make sure that I'm getting the patient also the right care, and if I'm not the right person, getting them to somebody in our system who can take the best care of that patient.